Hi, I'm Trevor Fossey. I'm a patient, basically. I've never had any involvement in the NHS. Like some people, I've been involved in the private commercial side, and I had a role as quality manager in a global organisation. But I retired last year and have become engaged in my own health. I've learned some different, I've just, before going into my session, I've comment on something about engagement side, and I've come from a slightly different view. I come from a project view on a sort of major rolling out a project, and engagement to me is always meant partnership with the individual and taking them on board and then becoming involved and responsible for the area of business, which seems a different level of or type of definition of the word for that I've come across in the NHS. I think the NHS, and maybe researchers, I don't know, have more of a military view that you're engaging with the enemy sometimes. But that's just a perception that comes across. But it is true partnership, respect for the individual, and that understanding. So I've been asked to give this talk about the engagement, my own engagement in health, as part of a patient online program that NSH England are running out. I've been asked to be a member of that program on the basis as a patient representative. I would add that I am still an individual patient. Although I'm a patient representative with NHS England, I am not talking on behalf of NHS England. I'm sharing their program and I'm sharing the benefits I've had of my own part of that program. I'm going to cover it in three quick parts as far as this evening is concerned. First of all, we're going to talk, just bringing people up to speed with what the patient online program is. Then go on to tell you how I personally have benefited from it, and I'll explain that in more course. Then what patients expect in the future, and this is from workshops and feedback. Looking first of all, we're going to say what patient online is, what's the implementation program, and recognising the risks involved. And there are some risks involved, but these are being recognised and being mitigated as can need be. Patient online, it's a program where from the 31st of March, any patient, or any citizen I should say, can ask their GP for online access to booking appointments, repeat prescriptions, and a summary care record of their own care record. From the 31st of March, 13 days time. You can go into your GP and ask for that, and they have got the functionality to give that to you, and all of them must do. That's their requirement. It isn't a gun held to their head that they must do. It's part of the GP contract, and they won't get paid if they don't fulfill their contract. So that's quite more motivation of making sure they do something. Timeline of access to records. I've got full access to my record. The Power of Information document that was initially part of the government's initiative issued in 2012 said that we would have full access to the record by 2015, but there's been the Royal College of GPs have come up with problems in that, so that's been pushed back by about a year. That it's hopeful that next year you'll have full access to your GP record online. So the implementation program, it's not something that was thought of, you know, on January 1st. They thought, oh, we'll try and get this in. It goes back to the initiative in 2011 about the information revolution, that government wanted to bring in more digital and give people engaged with things because they had access through the Power of Information document. And it's come about by, or most recently, the 5-year plan for 2020, where there is envisaged you'll have full access to all health records, including hospital records and anything to do with yourself. It'll be more like I don't know, where people are engaged with their financial health because they control all their finances and online and go in, and they envisage that digital health will become more like that. There's 4 suppliers. All suppliers can now provide the summary care record. There's TPP, which is System 1, it might be known at GP as, or EMIS. They've got 92% of the business, I understand, and they provide the functionality for GPs to be able to give you full access if they tick the box. So if a GP says he's got EMIS or TPP System 1 and say, I can't give you full access, and this is me speaking, not NHS England, I would ask him, why not? You know, he can tick the box, he can give you full access, ask for it. But part of the implementation program has been listening to what patients say. Input for patients has been very, very important as part of the program. NHS England have put together a patients working together group, and they ask patients to represent from various parts of the country. We'll be looking at the program, and I'm part of that program, and because of experience and my own experience on having access, I've spoken to a number of meetings about this to GPs and shared the experience. And we're going to be testing various apps that are going to be coming forward, which I'll explain more as part of the vision in the future. There are mitigating risks to recognise. There's knowledge gap, equity of access, which is very important, safeguarding issues, coercion. NHS England, with the Royal College of GPs, have put in a lot of work to set out some protocols for that. So there's a lot of support to GPs for that. Now, talking about my own personal experience of gaming online, I have had, I am registered with a GP in the West Midlands. When I asked him 2 years ago, when will the timeline give me access, he said, I don't know about it. So I joined the PPG, and I got on the agenda. They had been using online prescriptions and medication. I got it on the agenda, and from January 2014, I've had access to my record. I've personally had some good experiences of that, and I've been sharing those experiences on the information. And to cover a couple of the areas where there were risks, I've had the general benefits of experience. Everyone in here, I would imagine, knows the experience or the benefits of having online access to your banking. It's 24/7. You don't have to visit the branch to get money out. You can do so many different things with that. With a health record, it increases my safety. How? Well, I often visit London. If I have a relapse, I've had 2 strokes, one in 2008 and 2010, I've got type 2 diabetes. If I have a relapse, if I see a clinician, I can pull up my record on my phone. You can see my full record on the phone. Other benefits. I was going through customs in my previous role. I had meetings abroad going through customs, and I said, what are all those pills in your hand luggage? I was able to pull up a list of my medication. It's always with me. I don't need paper, and it's up to date. So those are the general. Now, specific access to my record has given me the following. It allows me to check the accuracy of my record. I'm the person who can tell if there's anything wrong on the record. I can suggest it's corrected. Some people do make mistakes in putting information in records. I can review and contemplate the GP notes. And if I've got time, I can expand on that, particularly because there was an interesting experience with that. And I can take the time to understand test results. As an example, that's part of my record. That is the Medicaid, or that was the result of some tests. If there's any GPs in the room, if you notice anything wrong, that's a good second opinion for me, so thank you if you mentioned it to me. But that's the result of tests. I am, as I said, I've got type 2 diabetes. I had an annual checkup on the, or an annual review for the practice nurse on the 9th of February. 2nd of February, I went for a blood test in preparation for that annual test. And in the past, I've been into the review, and she's explained all about the tests to me. But on the 3rd of February, as is noted on there, I was able to be sitting at home in my own time, go onto my record, look at my results, and it says on one of these, no pointer, says on one of those, or each of the tests, there's 14 different tests, lots of information to take in a half an hour appointment. But each of those tests, it says information about this test. And that's general information. So if I click on there, I get directed to a site that says lab tests online. I know it's trusted. I haven't had to search the internet and found out about the test, or put the wrong spelling in and found out about a completely different test or whatever. I've got the information of how is the test used, why it is important, what are the ranges. I took a couple of hours going through those 14. When I went in to the practice nurse and took up my half an hour slot, she said, "Oh, you can see your tests." And I said, "Yeah, I've seen them all. My diabetes, I'll hold my hand up now, is not being controlled that adequately at the moment, so we could talk about something more important. We could talk about," one of the things I remember and see on my notes, that she suggested I don't have sugar in my coffee. That caused a problem the next day. I went to a meeting at HealthWatch, and the girl there served me coffee without sugar, and I thought, hey, someone's security on my records, is it right? But she just made a mistake. She was accurate, actually. So the half an hour appointment only took 10 minutes, and I got more value from that appointment than I've had from previous annual reviews for half an hour. I wasn't filling my head with these tests and the results on there. So that's just an example of where it can be used. And if I've got time at the end, I'll explain another one where on the personal mental side, I've got equal value that was absolutely put me in control of my well-being. So, patients' expectations for the future. NHS England talked to their stakeholders, had a meeting at stakeholders, and worked on what patients expect for the future, and came up with this model, a patient-centered model of patients being empowered to understand and take control. That's what my sort of definition of engagement would be. I have control. I can see them, I can understand them, I can look at the information. Records are a vehicle for sharing between patient and practice. Ownership is another issue, but that gets discussed. I can see my care across a continuum of time, health and care, different services. Should be able to see my social care records. I'm a carer for my partner who's got dementia. I haven't seen her care plan. I've asked for it. I can't see anything online. Why? I'm a main carer. So across different services, but hey, different organisations within the health service I find work in silos anyway, and they won't even share them with each other, let alone with the patient. But the patient expects to be able to see everything for themselves. I have online access to all my services, all the information in my records from anywhere. If I was abroad, I'd be able to call up my record and share it if need be, if I had a relapse or any problem. And I can contribute to my record. I take my blood pressure. I have to take the phone in and show the app to the nurse or doctor when I go in. I take blood sugar levels. There should be a functionality to upload that information so that there is only one record. That's a quality aspect. All the information is on one database. And we care about, as patients, and this is true, we care about the equity of access. What about people who haven't got access? It's not so many people now, 84% of people have got access now. There's this theory I've heard from some NHS, or the older population don't use computers, but they do. People have got a sort of, I suppose it's part of that paternalistic culture within the health service and other organisations, public organisations. You know, they don't respect the knowledge and what people can actually want to have and can get out. And as I mentioned with that question, the PPGs, there's a wealth of information there, and a wealth of resource that can help. And on our PPG, we will be helping to share with people how to look at their record and that type of thing, to what the GP wants. And we need in place, we recognise these are mainly from other stakeholders, but we really recognise this. We need adequate capacity. We need all the things that support all the information. And understanding, you know, when it's possible and the benefits and the constraints and all that type of thing. So digital access to information, I'd say engagement. I feel engaged with my record now. I feel I control it. I'm a partner with GP. It's enhanced my relationship with GP and will improve my health being. It already has. I have online access to my records and all the information. I don't have online access to my hospital records. Hey, that's another view. When I was in hospital for 10 days with a stroke, I felt guilty reaching down the end of the bed and looking at my own notes. That's a culture. And so maybe the culture isn't only on the NHS, it's a culture of us as citizens and what we expect, you know, to have access. If a bank said, well, we're not going to show you all your direct debits, we'll just tell you whether you're okay as a financial state, would you accept that? Well, I know I wouldn't. So why do we accept it for health? I've taken the view that information is power. Part of it is empowerment, the paternalistic view of we control it, we've got the power, and we don't want to share it with you. But if it's shared power, it's important. Citizens who feel empowered become engaged. I think we heard it from the board that produced that website, the Be Respectful, Respected side. If they feel empowered to do something, you become engaged. I'm an expert in my own health. I see a GP and a nurse probably 3 or 4 times in a year, probably an hour a year. I live with it, 8,700 hours a year. If you think of that, 1 against 8,700, that's a big balance. So if I'm controlling, it's better. And it's that respect from what you said about people being at home and being able to control, and if they feel in control, and the message that's often come across is saying, well, we want you to do this and give up smoking and do that, but hey, we don't respect you enough to let you see your records. You know, it's a dichotomy of messages. It's people just look at the message and perceive what it means. So to change in culture, increase responsibility for health, that engagement will do, and there will become a patient citizen expectation. I would hope now, as having spoken to you guys, that you will expect to be able to see your own record. You'll say, yeah, I should be able to see it. You know, and you'll ask your GP to register on the basis, like even if they've not got a health condition, your own responsibility for your health well-being, and just like you would with a car, you wouldn't wait till it breaks down before you join the RAC, as an example. So benefits are for the individual. My well-being will improve. I feel more in control. I feel now more in control and ready to try and control diabetes more because I can see what's going on. Nothing's been written without my knowledge. Patients, information is underused in the NHS, but patients are as well. And what's going to happen is at the moment, NHS England have got a programme where the 4 suppliers are opening up their data to GP, SOC, or suppliers of choice developers who are producing apps that will be able to talk to the records, that will be able to have apps that people are using. I understand from information I've been given, but I don't know what the current situation is, that these apps, these preferred apps, will be free to all patients, and the suppliers will be paid by usage. So if one app becomes exceedingly popular, that supplier will do well. if they develop an app that doesn't listen to the patient's needs and isn't used, then they won't get paid much, which makes sense to me. That's a bit of consumerism of usage on that. So in summary, I'd say it's a call to action. 13 days you can go into your GP and say, can you register me to be able to get access online, please? They might only give you access to your summary care record, but ask them. If they're with EMIS or TPP, which is 92% of them, they can tick the box to give you full access. Now that's me speaking, not NHS England, because NHS England is working with the Royal College GPs. But does your GP want to give you full access? They can. As I said, 92% of GPs had access, and I would say hopefully that I encourage you to become health conscious, more getting the information, become more responsibility for your own well-being, not only for yourself, but if you've got any elderly relative, you know, like that an elderly relative might want to share the information with you. You can feel in control of it as well, and you can help them to understand. As a story on booking of appointments, one GP up in Huddersfield that I was speaking to at one meeting has given all appointments online now. Midnight, he switches a switch and all the appointments go online. His patients know that. The elderly patients get their daughter or son, many of them, to go online for them and book them in. Only 25% of appointments are taken up by the time people get on the phone and through the, you know, the process of making the appointment. But he said it's reduced the hassle on the front desk with the receptionists. It's actually calmed the patients down a bit. They haven't got so much waiting time to get through to book appointments. And they can book appointments 24/7. So that's a call to action that I'd share with you. And I do advocate it. I've used the social media campaign to get involved and persuade people, and will share it. And I'll be reminding people of how many days to go before the 31st of March quite frequently in the next couple of weeks. So I'd like you to take action, and thank you very much.